अस्सलाम वालेकुम या कनाब्दु व या कनस्ताइन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज मैं इसके 16 सीरीज़ का मेडिसन 25th में मॉर्निंग का पेपर करने जा रहा हूँ। तो लेट्स स्टार्ट। क्वेश्चन नंबर 1, a 25-year-old male with the complaint of shortness of breath, x-ray shows a large shadow in the chest. On echo it was related to right ventricle of heart containing hemorrhagic and the necrotic areas. This is rhabdomyosarcoma. Question number 2, there is a small cystic mass in the left atrium with the involvement of heart. It is the feature of the myxoma. Question number 3, important findings at the angle of Lewis would be opening of azygous vein into superior vena cava. Question number 4, acute memory loss due to which area damage? That is basically Charlie, which is the limbic association cortex. Next, question number 6, in RTA, damage to a shoulder joint at the lower border of the first rib will likely damage which artery? The subclavian artery. Question number 7, Redman syndrome occur due to the vancomycin. Diazepam relaxes skeletal muscle by acting on the interneuron. Female presence with the weakness in the legs upon MRI. Bilateral infarct in the frontal lobes. Tract involved will be the corticospinal tract. Question number 10, in the skeletal muscle, calcium binds to delta, which is the calciquestrin. Next, 11, the patient brought to ER unconscious. There is a breathing problem. Empty bottle of the aspirin found. How antidote will act? It will increase the tubular excretion of the aspirin. 12, the patient found unconscious near the empty bottle of aspirin. What antidote will be given? Bicarbonate. 13, the laser momentum attaches to the duodenum. 14, 512 hertz tuning fork placed over the head of the patient. Receptors involved are the Pacinian. Question number 15, the pain, temperature, and the crude touch is carried by which of the following? That is beta, which is the anterolateral spinothalamic tract. Next, question number 16, the gunshot wound to the anterior chest after crossing intercostal muscle. Which structure will it first come in the contact with? Endothoracic fascia. 17, the mechanism of action of the insulin is increase in the potassium inside cells. 18, the first sign of hypervitaminosis A is the beta jaundice. 19, the megaloblastic anemia feature is beta, the oval macrocytes. 20, the patient undergo gastrectomy, develop macrocytic anemia. The treatment must be the beta option, which is injectable vitamin B12. The cells which commonly form cells in atheromas are derived from arterial wall and the form circulating element. They are likely the monocytes. IgE released from the mast cells. Fisherman present with the complaints of weakness and early fatigue. He uses to have only fish and rice in his diet. His baseline shows HP of 7.8, MCV of 105. What could be the likely cause? That is Diphyllobothrium latum. Question number 24, the patient has the anemia and hypersegmented neutrophils present on the peripheral, but examination with raised MCV. It is basically the megaloblastic anemia. Next, 25, the technique used to detect abnormality in the microdeletion in the chromosome is the fish technique. 26, a 10-year-old boy presented with a pallor, easy fatigability, HB of 8, MCV low, which is the diagnosis iron deficiency anemia. 27, the interruption of the cervical sympathetic chain result in the Horner syndrome if sympathetic nerve to the eye are affected. Which of the following is the commonest finding? That is the drooping of eyelid on the affected side. Question number 28, what is the most dangerous complication of the Jorgen's syndrome? The beta cell lymphoma. 29, the patient presented with the keratitis xerostomia, joint pain. It is mostly likely he is suffering from the Jorgen's syndrome. Next, 30, the cytoclosporin X by the stopping T cell differentiation. The Clark nucleus level is the T1L2. Patient went to the prosthodontist. It did not fit in his mouth, so he was referred to a doctor on examination. He has rigidity and the tremors. Which nucleus is likely affected? The substantia nigra. 33, the Parkinsonism affects which of these areas? There is a substantia nigra. 34, the patient is having resting tremors. He is diagnosed with the Parkinson's disease. The lesion is in again the substantia nigra. Next, question number 35, the patient came to ophthalmology clinic with the complaints of gradual loss of vision. His accommodation reflex was present, but the light reflex was lost. That is the encephalitis. Next, 36, the histology of the macula densa, deep basal lamina. 37, old age patient complains of the difficulty in reading near things and accommodation issue. What is the cause? That is the lens curvature lost. 38, the hypocalcemia due to which effect on the heart? There is a systolic arrest. 39, aortic valve open when ventricular pressure rises more than beta 80 mm of Hg. Child was brought to an OPD with a history of episodes of bleeding and ecchymosis. HB 9.8, platelet 180. The diagnosis would be the platelet function defect. 41, what is a thrombolytic agent? That is the plasmin. Why cimetidine in the sacral fate should be administered at about 2 hours of gap in the patient of the peptic ulcer? Because sacral fate inhibits the cimetidine absorption. 43, the patient presented with the headache, neck stiffness and photophobia on LP. Glucose is 40, raised neutrophils. The diagnosis would be It is pyogenic meningitis as the neutrophils are mentioned. Next question number 44. The patient presented with the fever, neck rigidity, chronic sign positive, CSA finding reveal decrease in the glucose, increased proteins in the leukocytes 450, mainly lymphocytes. This diagnosis would be the tuberculous meningitis. A man lifted heavy weight, sudden pain in the arm, examination, swelling in his upper forearm of his muscle which is attached to the radial tuberosity. There is the bicep brachii. 46. The supination of arm is done by which muscle besides supinator? There is the bicep brachii. 47. The Varti lesion caused by the HPV is the condyloma acuminatum. 48. The functional remnant of mesonephric duct in the male is Charlie ductus deferens. 49. The blood supply of upper 2 cm of the duodenum is by the right gastric artery. Next, 50. After hemorrhage, HB binds with which of these, that is the heptoglobin. 51. The droplet infection can spread up to 1 to 2 feet. A diver after diving ascend rapidly, then develops shortness of breath and joint pain. The cause would be the nitrogen bubble. 53. The gas gangrene cause death due to the septicemia. Artery present at the base of the pyramid is arcuate artery. Next, 55. The cause of the pulmonary edema in IHD and the diabetes is increased hydrostatic pressure. Next, 56. The anterior to the left suprarenal gland is beta laser sac. Next, 57. Abscess in the perivertebral fascia will come superior mediastinum anterior to the vertebral bodies. 58. The test which rule out the disease is alpha sensitivity. Next, 59. The emergency department protocol is delta only patient load inside 60. In SLE, which type of hypersensitivity reaction is seen? That is a type 3 in obese patient. Wears a tight collar shirt and the feels tightness in the collar and the fan whenever he turns his head. Which of the following is responsible for this particular condition? That is increased venous compliance. 62. As a student of the final year MBBS witnessing surgery for the first time, collapse not due to vasovagal shock. Olfactory neurons are jolly rapid adapting mechanism action of Onden Satron or onset 5-HT antagonist. On ECG of the girl, you see sawtooth waves with P waves in a ratio of 3:1. Her pulse is regularly irregular. Which of the following has occurred? That is a flutter. 66. An ECG of the patient with the U wave. When there are U wave and inverted T wave, that is definitely the hypokalemia. Next, the deficiency is in which of the following cause the hyperexcitability? There is the calcium. 40 years old male with a jaundice liver function test shows the direct bilirubin 10, ALP 1000, ALT 75, GGT 2 to 7. What is the most likely diagnosis? That is the extrahepatic cholestasis. A 17-year-old boy is brought to the hospital in an ultrasensorium. He is taking slow, shallow breaths and his breath has a fruity smell. Fruity smell, that is DKA, diabetic ketoacidosis. 70. The patient presented with the palsies of the right limb and the right lower face along with the homonymous hemianopia. The lesion is in the internal capsule. Metabolic acidosis is caused by the decrease in the bicarbonate. Next, right atrium infarction involve which of the following? There is the pectinate muscle. Supporting cells of the pars nervosa include the pituitary-cytes. A patient present with the ataxia on the both closing eyes and open eyes. Patient sway with the open eyes and eyes closed. Lesion would be at the cerebellum level. The patient having tremors while starting some movements and this coordination, he is having lesion in the cerebellum. Pus that accumulates in the boils or abscess is mainly composed of the neutrophils. Next, 77. The patient has the kidney transplantation develop cyanosis and the organ failure within 10 minutes. The cause is antibody mediated rejection. 78. The edema in the kidney related disease in patients is due to beta the hypoalbuminemias. 79. The patient has given injection penicillin after which he develops shortness of breath, bronchoconstriction. What should be immediate drug to be given? That is IM adrenaline. Next, 80. Which condition is related to the eosinophilia? That must be asthma. The patient has the bleeding problems due to the mass on the lateral side of the sternocleidomastoid muscle. Which vessel is bleeding? There is a subclavian which will be increased in the vitamin D deficiency. The ALP. 83. The patient with a severe headache, vomiting, neck stiffness, raised ICP and lumbar puncture. There was blood stand CSF. This is blood stand. It definitely is subacnoid hemorrhage. 84. The treatment of SAH with CCB can be used. That is definitely nimodipine. 85. The diabetic patient having hypertension treated with the captopril, that is an ACE inhibitor. Link this diabetic hypertensive patient are always treated with the ACE inhibitors because they are renoprotective. The bone scan necessary for the delta retinoblastoma. 87. Most common skin cancer in the HIV/AIDS patient is the Kaposi sarcoma. 8-month-old boy was born to HIV infected mother. The most reliable investigation to confirm HIV infection in this infant would be HIV RNA detection by the PCR. The patient having traveler's diarrhea, not responding to antidiarrheals. Which drug should be given? Norfloxacin. The fracture of the artery on which artery is damaged? The middle laryngeal artery. A woman was cycling and reached height where atmospheric pressure was 700 mm of Hg. Which of the following is true? That is beta partition oxygen of 147 and the nitrogen 553. Next, 92. The unmarried female with the parotid swelling and the no lymph node enlargement. Which type of biopsy is used for the parotid swelling? In this particular case, there is aspirational goblet cells converted into the Clara cells at the terminal bronchioles. 94. The patient after RTA having 8% blood loss in 30 minutes with no change in the arterial pressure, which of the following has the maximum loss of the blood? That is the veins. The dental patient on the steroid went to surgeon. What will be first treated? The hypoglycemia. 16-year-old female presents with the hypertension and increasing weight. Which of the following features would be most suggestive of Cushing syndrome rather than the simple obesity? That is abdominal stria. 97. The Addison disease patient present with which feature? Hyperkalemia. 98. The dioxin toxicity increase when used with delta quinidine. Next, 99. Woman with a history of the trauma to the head and neck region having lesion on the tongue on the protrusion of tongue deviated left side. The nerve most likely involved would be the left hypoglossal. Next, 100. The patient had RTA. He does not know recent events, but he remembers his school events. Where is the lesion? That is the hippocampus, which is the falling act by the phospholipase. That is oxytocin. A pathologist see on slide that the neutrophils are utilizing oxygen. Burst oxygen reaction was seen in which step it is necessary? The microbacterial activity of the neutrophils. 103. The patient after RTA sacral region of the spinal cord damage has which effect? That is the neurogenic bladder. Next, 104. Patient loss of proprioception occurs after RTA, which is the underlying mechanism, that is the latent inhibition. 105. The patient's both eyes covered that looks toward the site of the lesion. Horizontal gaze center has lesion in the frontal eye field. Next, 106. The necrosis will have the dystrophic calcification. Soon after excitation there will be coupling of cross linkage of the actin and the myosin. 108. The most abundant antibody in the adult human is IgG heparin activate which of the following? That is the Charlie antithrombin. 3. The platelet releases the thromboxane 2 and ADP. The trypsin acts on which amino acid? That is a terminal carboxyl group amino acid. Which of the following decrease triglyceride level by decreasing the availability of the fatty acid? That is the beta gamfibrozil. Which one of the following directly control the autonomic reflex system of the body? That is the hypothalamus. Next, the therapeutic window of the drug indicates the effective blood concentration. Which one of the following they don't collagen the bone formation? That is the fibroblasts. 114. The therapeutic window of the drug indicates the effective blood concentration. 115. Which of the following lay down collagen in the bone formation? That is the fibroblasts. 116. The patient after RTA loses 2 liters of blood. Which of the following will occur? That is the increase the venous tone. 117. The last trimester of pregnancy. What change in the respiratory parameters occur? The decrease FEV into FVC ratio. Which of the following is detected by the peripheral chemoreceptors? That is the decreased partial pressure of oxygen. A woman test positive for the CA125. The tumor marker is of the ovarian carcinoma, CA125. The 120. Most common chromosomal abnormality is the Down syndrome. 121. The child playing jungle lion game, he got goosebumps. The mechanism would be the constriction of rectopili muscles. 122. The boy had a car accident after which he is bedridden. He developed DVT, he came to ER with the chest pain and the dyspnea. What will be the findings? The ventilation perfusion mismatch must be there. 123. In the grave disease exophthalmos is due to alpha, which is increase in the TSH. Next, 125, 124. The free radical formation inhibited by the hydrogen peroxide. 125. The renal part which run from the renal cortex to medulla between the renal column is the renal pyramid. 126. The female with the hand swollen the neck and is now 20 years of age with amenorrhea and absent secondary sexual characteristic. That is definitely the Turner syndrome. 127. The grade 4 cervical carcinoma which lymph node is enlarged. There is an internal iliac. 128. The female having UTI gynecologist advise urinary shows pus cells. Gram positive, coagulase, catalase positive, the coagulase negative. That is definitely the Staphylococcus saprophyticus. CCK is inhibited by delta, which is the somatostatin. 130. The fastest response to control the BP will be by the baroreceptors. 131. Which one related to the post-central gyrus? That is the somatosensory cortex. 132. The concentrated urine is related to which of the following? Increase water absorption from the distal convoluted tubules. 133. Then hyperaldosteronism, there is the increase in the plasma osmolality. 134. The tragus and the antihelix is derived from the first pharyngeal arch. 135. IgE in the allergic reaction can be prevented by the antihistamines. Next, 136. The lymph vessel involved in which of the following? The cavernous hemangioma. 137. The muscle that is tied to the more than one joint and prevents the excessive movement of the proximal joint, it is the fixator. 138. The following structure lie deep to and the parallel with the carotid sheet, that is sympathetic chain. 139. The difference between the spleen and the lymph node would be the splenic sinusoids. 140. The basal cell carcinoma, most common type is the nodular. 141. The after passing wedge shape catheter pressure increased by the 5 mm of Hg, which one will increase? That is the ANP. Next, what type of the wave will be seen on the EEG while solving math problems? That is the beta waves. Next, 143. The child developed diarrhea. Biopsy shows the villus atrophy, but gluten-free diet does not improve his symptoms. Diagnosis would be gardiasis. 144. The true but the chemoreceptors is the large receptive field. 145. The creases in the glomeruli are formed with the proliferation of the parietal cells. Next, 146. The megaloblastic anemia, there is a damage of delta the parietal cells. In galactosemia, the defect is in galactose 1 phosphatase uridyl transferase. 148. The findings seen in the cardiac tamponade will be the pulses paradoxes. 149. Which one caused the severe steatoria? The pancreatic resection. 150. The first line macrophage of the defense in the lungs would be the dust cells. A patient has the chest pain, having the cardiac problem from 1 year now, having the opening snap, mid-diastolic murmur, that is definitely mitral stenosis. 152. The 19-year-old student comes to you with a fever, sore throat, and the tonsillar lymphadenopathy from the last 1 week. This is due to the staph pharyngitis, the skin damage. Which layer of the skin will first regenerate the stratum basale in between the vertebra? The structure is called the nucleus pulposus, that is derived from the notochord. To prevent the iatrogenic infection in the ICU, we should use extensive hand washing after examining every patient. The behavior changes are produced in anxiety by the peer seeded. The mean in the large sample is represent the normal distribution. Which lymphoid organ has the paracrine action? That is definitely the thymus. Next, paraneoplastic syndrome occurs in the small cell carcinoma of the lung. The max aortic pressure in which phase of the cardiac cycle? That is rapid ejection phase. Which of the following selectively inhibits the COX-2? Meloxicam. Patient had the trauma on the duty. Doctor is unable to find vein for the cannula in the upper limb. Which vein is best for the IV in the lower limb? That is definitely the great saphenous vein. Which of the following drug is actively secreted by the kidneys? It is beta, which is a streptomycin. Next, the increase in the mean arterial pressure will cause the increase in the TPR. Most common site of the rib fracture is the angle of the rib. The region of the brachial plexus are placed deep to the clavicle. The byssinosis is related to the cautery industry. The patient has the cough and X-ray shows the halal lymphadenopathy, non-caseating granuloma. Non-caseating granuloma, definitely sarcoidosis. If it would have been a caseating, we could think about the TB. A patient having the chronic gastritis develop ulcer due to the H. pylori. The stagnant hypoxia occur in Charlie, which is the polycythemia. Next, 171. The submucosal fibrosis is the pre-malignant condition. Normally, physiological function of the placenta is the prevent maternal and fetal blood mixing. Mother Rh positive, fetal Rh positive, and the father is inactive. What's the risk? That is the Rh antigen will leak in the mother circulation. A person running in the marathon race, blood flow to the non-exercising muscle is by the sympathetic cholinergic. Next, 175. The patient of the chronic hepatitis C with increased ALT AST. The cause of increased ALT AST is which of the following? That is the hepatocyte membrane damage. A patient had the non-productive cough for the 2 months, non-smoker, now presented the blood sputum. Left lung has the 5 cm hilar mass. The sputum shows the hyperchromatic pleomorphic cells, which scanty cytoplasm. Cause of this condition would be the radon exposure. The terminal bronchiole contains the clara cells. The patient cannot utter words due to the damage of the Broca's area. The hearing-Breuer reflux will lead to the inhibition of the dorsal neuron of the central respiration. 180. The characteristic of the glycogen storage disease is the hepatomegaly and the hypoglycemia. Olfactory receptors adaptation in the first second is the 10%. What happens? The whooping cough, that is hypoplasia of the respiratory bronchioles. The cranial and the spinal nerve both supply the motor supply to the muscles. Drug which have the more clearance than the inulin will be filtered and secreted. Sickle cell anemia, the child has the painful abdomen and the legs and low HB. Which hemoglobin will be seen? That is the HBS. The anterior sternal costal surface of the heart is formed by a beta, that is right ventricle folate level checked in the megaloblastic anemia by the RBC folate level. In the TB, the hepatitis involved in which type of the reaction, that is the Charlie type 4 hypersensitivity reaction. The surfactant production is increased at the following: there is the deep breathing IgE present on which cell, that is the mast cells. Child diagnosed with the genetic cause of hypocholesterolemia. Father had the same problem. Defect will be in the alpha, that is the LDL receptor. Next, 192, that in the patient with the type 1 hyperlipidemia would be the decrease intake of cholesterol and saturated fats. Last 193, the 20 years old young boy presenting the fever, headache, vomiting. He is having neck stiffness and ultra mental status with the hallucinations. Which among the following is the brain eating parasite? That is the Naegleria fowleri. So that's it from the SK16 medicine section. Thank you for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.